Hi, do you suffer from peripheral neuropathy? Peripheral neuropathy is burning sensation, pain, numbness, tingling, sharp stabbing pains and cramps of your hands or your feet, your arms or legs. My name is Dr. Wada, and I am the director of our clinic here in Torrance, California. We've treated a lot of patients with peripheral neuropathy. There's a lot of different reasons for having peripheral neuropathy, and I'll tell you right now, a pill like gabapentin or Neurontin or ibuprofen is not going to solve your problem. It doesn't go into the cause of what's creating your problem. That's what we do here. We do more functional medicine and neurological care. Now, neuropathy is one of those conditions that if you have it, it can progress. It's a very progressive condition, and it starts off usually just with mild symptoms such as what we had talked about: pain, numbness, tingling, etc. And those symptoms won't really be debilitating. They may be annoying, they may be something you notice, but as time goes on, it can become more moderate. Now it may be affecting your ability to perform certain things, such as golfing. Maybe you're not golfing as well. Maybe just walking. Maybe dancing. Maybe you have a balance problem due to your neuropathy. Then it can also progress into a more severe type of condition where you don't have good function. Basically, you would end up in a cane or quad cane or a walker, or perhaps even in a wheelchair in the end. That really disturbs or affects your quality of life. And that's what we want to protect for you, is your quality of life. Now, a lot of people say, well, it's not that bad and I don't really need to do anything about it now, but the sooner you do something about it, the easier it will be to get your condition under control. Now, what we do in this office is called neurometabolic care. We look at the patient not only neurologically, but we look at them metabolically. We also look at the patient structurally. So we stand back and we take a look at the whole person. We don't treat a diagnosis. A diagnosis basically is what the medical doctors do, and they give you a pill to cover up your symptoms to make you feel like you're doing better. But in reality, as time goes on, your condition will spiral down and become worse. So with neurometabolic care, we look at the brain, and the brain needs two things to survive. It needs fuel and activation. Fuel comes in the form of glucose and oxygen. When you don't have the right mixture of glucose and oxygen in your brain, it's like a carburetor with the gas and oxygen coming in. If there's not a good mixture or the right mixture, then your car will backfire. And the same with the brain. So we have to look at you metabolically. Metabolically basically is looking at your blood sugar. Your blood sugar, you may be hypoglycemic, or you may have insulin resistance, or you may even be diabetic. Now, when you have a bad level of glucose going to your brain, then of course it won't create the right mixture. On the other hand, with oxygen, if you have some type of anemia, such as iron deficiency anemia, well, iron binds to oxygen and it takes it around to all the cells in your body. And if you don't have enough iron in your blood to bind to this oxygen, then you'll have a deficiency of oxygen going to your brain. So here you have now, you have glucose and you have oxygen. And if it doesn't have the right mixture, then your brain will backfire also. Now, on the other hand, with what I was saying before, fuel and activation, we have to activate your brain in order to make it work. It works on stimulation. And some of the stimulations we do here is like auriculotherapy, vibration stimulation, olfactory stimulation, electromuscle stimulation, ultrasound therapy, cognitive therapy, There's a lot of different ways and methods that we use to get the brain activated. So if the brain is activated, then it's going to work better. So you get a good mixture of your glucose and oxygen and activation to your brain, and your brain will work better. If it doesn't work good that well, then it will affect your body and it could end up in neuropathy. So we look at you that way. We look at you neurologically and metabolically, but we also look at you structurally, because if you have some type of pressure on your nerves, that can also cause neuropathy. Now there's two things also that can cause neuropathy, and this is a very, we're finding to be very prevalent in many patients with chronic conditions, and that's inflammation. Inflammation is caused by two things. It can be caused by food sensitivities, or it can be caused by bacterial infection, or some type of infection, such as bacteria, parasites, viruses, yeast overgrowth. So these are things we look at when we treat our patients, and because of it, we have been very successful with treating people with neuropathy. It takes a lot of investigation. We're like detectives looking for the cause of why you have this problem, because something is creating it, and so we need to find out what it is, and we need to deal with that. So every patient that comes in has a different story, has a different condition or reason for their condition. If you'd like to find out more and come in to our office for a free consultation, then we can set one up if you call us at 310-516-9989. So come on in so we can see if we can help you. All right, thank you very much.